Hey everyone, and welcome back to the stream. It has been a while. It has been a while. Today, we're going to be answering questions about medical coding. We're going to talk a lot about some of the certifications, some of the training. We can talk about some of those changes that are happening for 2023, how everyone's preparing for them. And if you are coming here after the fact, definitely hit me up with a hashtag replay. Let me know what is your big takeaway from the stream. And let me see if I can get this going. It's been a minute. Okay, here we go. Here we go. Where is my video? You guys haven't heard the theme song in a long time, but here it goes. Welcome everyone to the Contempo Coding live stream. Yeah, we're jamming, we're jamming. So hey everyone, it's great to hang out here again with you guys. I hope everything's working okay. I can't get my side camera to work. The settings on that one, it's been so long that I can't get but we don't need the second camera. But hey, I just got back from vacation. I want to apologize because I apparently got like the ick while I was there. It's not COVID. I'm testing negative for that. It's just the common cold. But sometimes, when I'm not feeling so hot, doing a little bit of something like this kind of gets my mind off of just sitting and feeling icky. So it helps me out a little bit. So I'm glad to be here on Saturday, hanging out with you guys once again. But yeah, I was out. Took a Halloween cruise, Disney Halloween cruise to the Bahamas. I went to Castaway Key and did the 5K there, and it was wonderful. Got to go snorkeling and see some of the hidden treasures. My big thing was I wanted to see the hidden statue of Prince Eric, and I did that. So now I'm back trying to get back into work mode. So let's get into it. We already have 30 people on the stream today. One of the questions that I saw come in kind of early on, and I don't know if it was in LinkedIn. I don't know about you guys, but I have turned off my comments, my notifications on LinkedIn because they've been sending me notifications that are just like the weirdest thing. I don't know if anyone else is getting these, but it's just like sending me notifications that someone commented on something that was totally unrelated or that they posted something. And I'm like, this is just getting too much. I have no interest in knowing that someone I'm not even connected to made a post. So for mental health purposes, yeah, I turned off my LinkedIn notifications. It was just getting to be way too much. One of the things that came up recently, though, um, was someone asked about the CCA exam. So the CCA is through a HEMA. Let's actually take a look at this over here. The CCA through a HEMA, and it's their Certified Coding Associate. It's kind of like their equivalent to the CPCA. As far as if it's worth getting any more, that's kind of debatable. I would lean towards no. And here's why. So first off, one of the things that you can see here from a HEMA is there's not actually a lot of people that have the CCA. Like I think it says on here, what is their 2019 status here? How many people have the CCA? I just saw it. As of oh gosh, now I'm gonna have to control F. That's the wrong screen, Victoria. Where was it? There was something on here that had about, maybe it was this one. As of December 31st of 2019, there was less than 8,000 CCA professionals. So we're talking not a significant amount of people. Certainly not the amount of coders that we have that have a CPC or even a CPCA. And from what I've gathered, again, I'm not certified in I don't have any AHEMA certifications. I've thought about it at this stage in the game. For me personally, it's not worth it. I think for some people, absolutely, especially if you're looking to get into inpatient coding, it would definitely be worth it. But for me, it looks like they've kind of reduced some of the qualifications to just get your CCS. So if you're able to, and you can find a way to meet the eligibility requirements, I would try to go right to the CCS versus the CCA. Because what's going to happen is if you get your CCA and eventually you want to get your CCS, you're going to have to retest again. You're going to have to, pay the exam fee again. So if you can find a way to meet some of these eligibility requirements to just go straight to the CCS versus the CCA, I would probably do that. And I would really gear more towards that if you know you want to get into inpatient coding. If you know definitely you want to get into inpatient coding, then the CCS is probably more accepted for that. We're starting to see a lot more employers, though, that are accepting the AAPC CIC. But again, when I talk about medical coding credentials, and I have so many people, and they're like, I don't know, like there's so many credentials out there. There's like this AHIMA, there's the CBCS, there's this, there's that. Like if you are genuinely like, it's too confusing, and I don't know which one I want to get. Like you can't go wrong with going with the AAPC and getting the CPC credential. You really, really can't. Yeah, Kung Fu Ken is saying, like, there's definitely not enough benefits of getting the CCA. And, the other good thing to do is if you're looking at a credential and you're like, "Oh gosh, and, I don't know if this is gonna be beneficial to me," one thing I like to do is actually go on to, like, Indeed.com and search for that particular credential. So there are jobs available that it looks like they might take a CCA, but then again, we also have to be careful. Some of these might say no CCA, which will also trigger those search results. So let's see what it says like on this one here. Okay, so here it says they will take a CCA. So at least we know that that's like a legitimate credential that certain employers are looking for. We can start doing some of our research here and looking at these jobs and saying, what are the credentials that they're looking for? What are the qualifications that they're looking for? And are they accepting this credential? Because some of them, I'm just going to say aren't bringing up a lot of search results. I'll just say that. That's all I'm saying. Ooh, Monica Brown has a good question. I am a Z. Excuse me. Again, I got my cough drops already, but I'm thinking as I talk more, it might help me kind of bring up some of the stuff that I've been just kind of holding in there. I'm a CPC and I am preparing to take the CDEO. My question is, what are your thoughts on taking it online? So, one of the issues that I've had with being able to advise people on this is for the longest time, the only credential that was available online was the CPC. I already had my CPC, so it's not like I could retake it online to get the experience. So, as soon as the rest of the credentials were online, I went and took my family practice certification for not because I needed an extra like I need an extra certification, like I need a hole in the head right now. Honestly, now that I think of it, I'm not sure my certificate has even come, and that's fine with me because I don't think I have room for it anymore. But one of the things that I wanted to do is get that experience of what it's like to take the certifications online to kind of give everyone the feedback. So I personally think it depends on you. Some people really like to be able to take that pen to the pencil and write things in their booklet and scratch things out. And if you need that, it can be a little bit harder with taking the online exam. Now, so with the online exam, you basically get almost like notepad that you can kind of scratch paper with. Like, let's see if I have. Do computers come with notepad anymore? I don't think they do anymore. What is this? OneNote? Is that it? Is that the same thing? No. But basically you get that. You get almost like a notepad type of application that you can open to like draw and not draw, but like kind of take notes on. Let me kind of show you almost in like Word. So like if I was taking an exam online, I have unused documents here. So if I was kind of taking my exam online, I would have, it's almost like a split screen. And instead of like being able to cross things out and write yourself notes, you can do process of elimination this way. You could do like A, B, C, D, or if you wanted to write down like, oh, I don't want to forget, maybe it might be 42571. I don't know if that's even a legitimate CPT code, but like you'd have to type it out and kind of like write yourself little notes on the computer versus having scrap paper. Because what could happen potentially is we don't want examinees writing things in their books, exam questions, for example, and then taking them out and then posting them online, and then people cheat on the examination, right? So for that purpose, you're not allowed for the online exams to have writing utensils, scrap paper, anything like that, so that you can't violate the integrity of the examination, basically. So if you're someone who really, really needs to write, you probably would want to take it in person. I didn't think that the online examination process was that hard. I encourage reading a lot of stuff about that the AEPC sends you, all those notifications that say like, here's what you're going to expect, here's where you're going to have to log in, make sure that you click this and this, and that you're allowed to bring what books you're allowed to bring. Because now there's a differentiation in the instructions between what you are permitted to take for in-person exams versus for online exams. So for example, the online exams, you are not allowed to bring laminated scorecards. And that was extremely difficult taking some of the exams online. I had one question that was basically scoring something out on a 97 bullets list, and I couldn't bring up my bullets and anything to like write with on the same screen. So it was very difficult to like count the bullets and look at the note. And so that part was difficult. Now, of course, 2023, we won't have to worry about bullets anymore. They might, I don't know, maybe they will throw some questions in there about how we scored things prior to 2023, but who knows? So that component was a little bit difficult. Some of those online embedded things were a little more difficult to navigate. Let me see if I can actually take you over to kind of the to kind of show you how they differentiate now between what is permitted for the online exams versus the in-person. Let's see here. What's allowed? Confirm what reference materials are allowed. Here we go. Okay, so the examining instructions look a lot different than they used to, right? And this tripped me up too. Like I was first tripped up because if you'll notice here, it tells you this is your in-person and what's allowed, and in-person what's allowed. And then down here is for your electronic, your online proctored exams. So there's a difference between what's permitted for those. So you'll see here, for example, for the in-person, some of them you're allowed to bring. Let's see here. Where's one? Reference guides. Oh, so for these, like you're allowed to bring your documentation guidelines for these. That's not listed as a reference that you're allowed to bring for the electronic exams. The reason being is there's a button you can click and it'll bring up the digital version of it. So they don't want you having those paper copies of the exam guide of the 95 and 97 guidelines, the E&M guidelines with you. They're all already provided for you in an electronic format. You basically click a little button and it brings it up. So there's a big differentiation now between what's permitted in person and what's permitted online. And yet the other thing that I found different about the online exam is, and this might just be for specialty examinations, not necessarily like the CPC, but when you take the examination in person, you have your bubble grid and you just fill in your bubbles, questions 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For the one that I took, it was case studies. So there was like 20 to 30 case studies, and each of them had maybe like 3 to 5 questions about that case. So I didn't know that I was on question number 46. I was on like case study 3, number 5. So it was different in that kind of setting as well. Can I please go over laceration repairs because providers are being too vague in their notes? That sounds like you need to talk to your providers. If your providers are being too vague in their notes, that sounds like you need to have some provider discussions there. Do you think it is beneficial to get the risk adjustment certification? I think so. I think a lot more employers are looking for it. Again, kind of like going back to our Indeed.com. There's a lot of employers that will just take a CPC because they know as part of the CPC, you have to learn ICD-10 CM coding. But I think more are looking for the CRC because they know that there's an advanced knowledge there. There's a proof that you have more definitive training in the guidelines, you have more in-depth knowledge of risk adjustment, the different programs, and I definitely think it's worth getting. I'm seeing a lot more coders who have held on to their CPC and CPC only for years and years and years, and now they're getting their CRC because of how prevalent it's become in reimbursement, not just for insurance companies, but for providers as well, that there's so much value-based care going on that they're receiving bonuses, they're receiving increases on their fee schedules, and those are all surrounding outcomes. They're surrounding value-based care, and part of that is risk adjustment, proving that we're taking care of these really high risk, high cost patients and keeping the costs, below what we're anticipating. I want all the excuse me. I want all the certs, just kidding, but I think I want to do outpatient or reimbursement or revenue cycle. All of those would be great. Outpatient, reimbursement, refs. I think the more you know about revenue cycle, that will benefit you in just about anything. One of the things that I've always felt that I lacked in is I don't really know anything about provider credentialing or enrollment processes, and that's an area where you know, it's hard to find courses or training specific to that. And I wish that earlier in my career I'd have spent more time with some of the people that have familiarity with those areas and spent some time maybe shadowing them and learning kind of some of their stuff. CEMU. I'm not sure what CEMU is. Can you elaborate for that for me? Because I'm not sure what CEMU is. I have my CPC. What are your thoughts on outpatient documentation certification? I think that is really up and coming, and it's very worthwhile if you're someone who wants to work in provider education or you want to work with providers on their documentation and documentation improvement. If you're looking at it because you just want to be like, I have this, fancy credential, and I think I'm going to get paid more because I have this. No, but if you're someone who wants to work with providers, I'm seeing a lot more organizations. There's one out near me. Is it St. Luke's, where they have a group of outpatient CDI now, where they have people that look at stuff and they want them to have their CRCs and they want them to have the CDO because they're doing a lot more provider based documentation review and making sure that they're meeting those requirements on the outpatient setting, the provider based setting, not just inpatient. Is there any benefit to having certifications with both a HEMA and AAPC? Yeah. I think so. Um, you know, uh, I know a lot of people that are dual certified. They have certifications with AAPC and a HEMA. It kind of depends. Like if you want to learn inpatient coding, but you're not maybe wanting to work in inpatient coding, you could just get your CIC if you already have your CPC. I think it's nice to have both organizations, but then you have to kind of weigh that you're going to need to pay 2 membership dues. You're going to have to get 2 organizations continuing education units fulfilled. It's a little bit more than to juggle versus just picking one or the other. If you started out with a HEMA, they don't have a lot of the certification growth that the AAPC has. From what I understand, it's also a little bit harder to obtain continuing education units for a HEMA. Sometimes I hear that coders are saying they have to pay more for getting their CEUs. They don't have as many free opportunities that the AAPC has with things like local chapters and stuff. So I think it's something that you have to really look at and weigh. But if you're someone who's just like, I want to get all the credentials, you can definitely do that a lot more with AAPC versus a HEMA. The CEMU. Oh, I'm sorry. I had myself on mute. Oh my gosh. So the CEMC is I'm sorry, CEMC. Oh my gosh. CEMC is the one that AAPC has for evaluation and management coding. CEMU, I'm not familiar with. If you wanted to get certified in just E&M, I would say go with the AAPC's E&M credential. Or I know, is it NAMUS that has a really good one too? I'm pretty sure it's NAMUS. NAMUS. By the way, I'm heading down to the NAMUS conference. Look at that. It's already trying to head me. I still got to pay my membership, my registration for it. NAMUS E&M certification. I've heard that one's a good one too. I feel like they still have one. CEMA is the one through NAMUS. So that one would be good. But yeah, the one through the AAPC I think is worthwhile too, particularly if you're going to work in specialties where they do a lot of E&M coding, like family practice, or if you're working with a lot of consults for providers. Yeah, definitely worth that. I'm about to enroll for medical coding this November 16th. Yeah. But I'm excited but nervous. I mean, that's the right mix of emotions to have. Anytime you're doing something new, you're going to have some nerves available. It's a big investment. It's probably a career change for you. Even if you're already working in healthcare, it's probably something different that you're doing in healthcare, but yeah, good luck to you. Excuse me one second. I got to take care of my nose. Oh my God. I muted myself again. Jessica Kelly coming in with $10 super chat. Thank you so much, Jessica Kelly. Appreciate that. How many jobs do I currently have? One. Oh, yeah. You know what? I did have two for a while. I'm down to one. I was teaching just like a couple of students at one of the local colleges, and now that term ended and I'm not continuing with that. So yeah, right now my job is just CEO of Contempo Coding. What I do, basically the channel is my full-time job. I do the channel, I do affiliate income, I do a little bit of consulting projects for 1099. So I'll take things from like Code Health, like when they have little projects, I'll do some small 1099 gigs here and there. I take what I refer to as almost like micro projects, because what I do with my online courses and with the channel and with content creation, it takes up so much time that there's really not a lot of time for everything else. So it's mostly that, those tiny little micro projects. Like if someone's like, I just need like a handful of charts audited for like a couple of providers, or someone has, a couple of weeks of backlog, or someone needs a webinar created or some training, like I'll do that. But yeah, I'm not someone who wants to scale and have like, a team of 50 people, because I can barely manage myself, let alone a team of people. So yeah, that's nice. You want to get back into teaching? There's a lot of great teaching opportunities coming up with different colleges that want to teach the AAPC curriculum. And the AAPC has so many openings anymore for instructors through their online live classes as well as teacher aides. Jenny Spencer, thank you for becoming a new YouTube member. Yeah, you know what, Jessica King? It's crazy. We're at what, 85,000 subscribers now? And statistically, I'll probably hit 100,000 around February. And get my silver play button, which is exciting because I gain about 4,000 subscribers a month, and right now I'm at well over 3 million views total for the channel. So it's crazy. Absolutely crazy. Pam, yeah, thanks. I'm having a good time doing the Coding Consultant podcast. Yeah, it's a hoot. What certification was I talking about with outpatient provider? I do a lot of provider education on the HCC side. The CDEO, that's the documentation expert outpatient that the AAPC has. Let's see here, view all certifications. I'm getting better now at navigating the new design on the website. Find the right certification. CDEO. So they have the CDEI, which is inpatient. CDEO is outpatient. And actually, I like that they give you some of the salary information here too. Let's see. Can help professionals exceed the annual average medical coding salary of $54,000. In fact, the CDO is among the highest paid credential with the average salary of $73,723 a year. And this one, it looks like it covers the purpose of clinical documentation improvement, provider communication and compliance, clinical conditions, diagnosis coding, which is interesting. So there's 20 questions on clinical conditions, 10 on diagnosis coding, documentation requirements, payment models. There's only 10 questions on procedure coding. So not a whole lot of actual coding, more so that knowledge about how to communicate with providers, payment models, sounds like some more compliance stuff too as well. Yanera, thank you for coming in with the $5 super chat. Greatly appreciate it. What is the secret for making your YouTube channel successful? I know this is terrible saying this because I feel like I've spent a lot of the time here talking about me and what I do on my live, but the biggest focus for the success of a YouTube channel, mine or other, what is, first off, you have to start. You have to be consistent. You can't just be like, I'm going to post a video here, and now 2 months later, I'm going to post another video, and then I'll post 5 videos within a week. Set a schedule and stick to it. Aim for not perfection. You can perfect things as you go along. But the real key is, you need to identify. Let me backtrack. So there's a couple of things with being successful in YouTube. You have to provide content that either people are entertained by or they're informed by. So for mine, it's informed. People are coming here because they're looking for an answer. They're looking for information, and being able to identify what people's questions are, what pain points they're having, and being able to provide information on how to solve them, answer those questions that they're having, and not like dragging it on that it's like, oh, what's the best medical coding certification, and it's this 2-hour long dissertation. Like being able to kind of do it in a fair turnaround of time. That's really the key to it, is just being able to provide a lot of value dense information to people. And you have to be to some degree entertaining, but that kind of comes over time. Funny side note. So I work mostly in this office, but I also have a co-working space, which is nice because I get to work with other people that have businesses and get involved in kind of my local business community. And one of the girls that I share my co-working space with is a very popular TikToker. So it's nice to have someone now that I can talk to about like content creation things and like bounce ideas off of. And I'm like, oh, did you get your YouTube handle? And we can kind of talk. So that's it's just nice to have that too. Carmen, I have created my own coding business LLC. I want to do contract 1099 services. My specialty is spine coding and revenue cycle management. Can you give me any recommendations on how to market? What I would say is, first off, stay away from Instagram. I think there's just not a value there. LinkedIn obviously is going to be a good place to research. But if you can do anything to kind of prove your knowledge, prove like some interesting tidbits about spine coding. Maybe people that you've worked with in the past that can say, oh, I've worked with Carmen in the past and she's been great. Have you thought about going out and speaking at some local chapters? Now, obviously, that's a little bit touchy because you can't go out with the intent to like promote yourself, but you want to get your name out there. You want to maybe write an article for Healthcare Business Monthly about spine coding or revenue cycle management. You want to start doing some webinars just to kind of get your name, your face out there. And as people become more familiar with you, they'll become interested in your businesses. They'll be like, oh, Carmen, she's doing a great job, and then that word of mouth starts moving, right? So when someone's like, oh, I had this really great, spine coder that I spoke with at a seminar or a webinar or at a chapter meeting, and when someone's having issues, they'll go, oh, let me get you hooked up with Carmen. Izetta says, I have CPMA as I'm an auditor. The exams through the AAPC. Yep. And you must join and pay dues to NAMUS, but you can get free CEUs. NAMUS is so good. They're such a great organization. I'm excited to go to the NAMUS conference in December. I need to book my flight too. My gosh, I'm behind on stuff. Just behind on stuff. Joy Peters just started the AAPC CPC online course. Awesome. Congratulations, Joy Peters. Studying business concepts until my eyes are bleeding. One of the videos that I'm actually planning, I think I've got it mostly put together, is the introduction to kind of like insurance. Because that was one of the things when I used to work with residents that is surprising that they don't know about. A lot of residents that they've been so focused on learning medicine and learning, how do I not kill my patient? They don't really know, some of them, the difference between a Medicare versus a Medicaid versus a commercial insurance and a copay and a deductible. And I'm really looking forward to getting that video out where I explain kind of some of those more introductory insurance business concepts for healthcare. Kind of almost make it like a series of, medical coding for providers. Charlotte Miles coming in for $1.99 super chat. Thank you very much, Charlotte Mile, in case I missed you. Yeah, I know it's going to be great. I'm hoping, it's early December, so I shouldn't be hitting any snow at that point. So no notes in my books for the online examination. So let's take a look at this. I'm gonna show you what it says on the AEPC website, because a lot of people online will steer you all over. They'll say, I did, I did this, I did that. You can, you can't. So we're gonna go right to the horse's mouth. Let's see here. AEPC exam FAQs. In-person and online CPC exam FAQs. Where is it? What is allowed in our books? Okay. So handwritten notes are acceptable in the coding books only if they pertain to daily coding activities. Questions from the study guides, the practice exams, or the exam itself are prohibited. So you can't write your study guide questions, practice exams, etc. Those are not allowed to be written in your exam. In your code books. Tabs may be inserted, taped, pasted, glued, or stapled in the manuals, as long as the obvious intent of the tab is to earmark a page with words or numbers, not to supplement information in the book. So you can't like go out and buy a whole bunch of sticky notes and be like, oh, this is my tab, and then you wrote a whole bunch of information on here and just like stuck it in your book. You can't do that. But if you have a tab where you wrote on here, cardiology or integumentary or diabetes coding or whatever, and it's clearly just to like mark the page, those are allowed. And you're also not allowed to Go back over here. Alter whiting out painting or printing over pages with the code books, such as the marketing pages, table of contents, reference pages, etc., to supplement information is prohibited. So what that basically means, and let me see if I can find a page here in my 2023 book to show you. So let's say I went through my CPT book and I'm like, I'm going to write as many notes as humanly possible. I'm going to write a whole medical dictionary in my code book. What you're not allowed to do is you can't be like, oh, I'm just going to take this CPT advisory committee page and I'm going to white this whole thing out and I'm going to write med terms in here, or I'm going to do a diagram, or I'm going to write in study guide questions, whatever. That you can't do. You can't like white out a whole page and then write notes over them. So that's not permitted either. And then it says no materials other than tab dividers may be inserted, taped, pasted, glued, or stapled into the manuals, which is different for a HEMA. A HEMA, and I can't ever seem to get a straight answer from them, but supposedly you're not allowed to write in a HEMA in the books for HEMA exams, but everyone swears up and down that they're like, oh, I took in the HEMA exam and they allowed me. See if I can find anything real quick that says anything about it. HEMA certification requirements. I know there's something on the HEMA website about it. Let's see here. Member benefits, certifications. Let's see. Certification exams. Let's take a look at the CCS. Apply. Mandatory code books. Let's see if it's on here. I know it's probably buried in one of those long books. We're not going to spend a lot of time looking for it. All right. What's next? Do you think it's better to get certification through AAPC or NAMUS? I have memberships with both AAPC and NAMUS. I don't have the certifications through NAMUS. I think if you're starting out, definitely go with the AAPC, because NAMUS is more so for auditing. Yeah, you know what? I've seen some people they get those tabs from Etsy. And I think it's definitely good for if you're taking your certification exams. It maybe is not something you want to get like every single year, unless you're very heavily using your books and finding them speeding up your time. Incognito Potato says, hi, Victoria. I remember you mentioning in a previous video once about a document that describes procedures for charge entry of coded encounters. That describes procedures for charge entry. Are you talking about the lay descriptions? Like the one that gives you like the full descriptions of what a CPT code is? That's the only one I can kind of think of right now that you might be talking about. Oh, Devin Hoff. Excuse me. Oh, goodness gracious. I'm currently in an AAPC CPC course and won't be taking my exam until after the new year. With all the changes to E&M in 2023, how much do you think my score could be impacted by using the 2022 books? That is a good question. Let's take a look at how many questions, I think it does give a breakdown of how many E&M questions are on the CPC exam. Oh my God, there it is. I've been trying to find this I saw it once, and then I was gonna LaMonica Alexander, do you know that you are on the AAPC website? Do you know that? I found this once before, and I was going to screenshot it and send it to her. And for whatever reason, then I couldn't find it again. Here it is. There is LaMonica. She's so wonderful. Who else is on here? Anyone else I know? Is there anyone else I know on here? Emily Smith? No. That's so cool that I finally found LaMonica again. Okay. About the CPC exam. Let's see if I can find it. Where's my exam breakdown? Prepare for the exam. Maybe it's here. Da, 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 da. Practice exams, areas of weakness, preparation exams. Why can't I find it? Taking the exam. It used to be so easy to find some of the stuff about the exam breakdowns, and now I can't find it. Here we go. Okay. So there are 6 questions on the CPC exam about evaluation and management. So really the question for you then is, how much risk are you willing to take on possibly getting all of those 6 questions wrong? Because if they're office-based visit questions, it's not going to make a difference. If they're anything other than office-based, it's probably going to make a difference. And they're not going to all likely be office-based. They're going to be hospital inpatient consultations, emergency department, which is different in 2022 versus 2023. So that's a personal decision for you on how much risk you want to take on not getting some of those 6 E&M questions right because of having an outdated book. As far as as far as training though for 2023, I'm pretty sure the AMA has some stuff available by now. And I'm sure some of the Medicare contractors do as well. Let's see here. 2023. I mean, if you want to be super dry about it, you could just read the entire. How many pages is this? Oh my God. 42 pages for the changes for 2023. But yeah, I have a feeling the AMA has something available somewhere that you can sign up to. I'm sure everyone under the sun is going to have 2023 training. Every consulting organization, the AAPC has training. I think there may have been something I signed up for even to get some free training that like Ray was hosting. I may have missed it already. I'm not even sure. Leroy says, I'm preparing to write my CPC exam in December, ma'am. Any suggestions? Absolutely. I have the best suggestion. The best suggestion is I know this awesome girl, Victoria Mull, and she has this YouTube channel where there's like a ton of tips about the CPC exam. There's actually a whole playlist that I have of CPC exam tips right here on the channel. So if you go here to the front and then you go to CPC exam tips, that's what you need to start getting refreshed with, because that'll help you out the best. Devin, absolutely. Absolutely. I'm a coding goddess. I wish. I don't think I'm as strong of a coder as people always think I do, because people will come up to me and they'll be like, oh, you probably know this off the top of your head. How do I code for? And then they'll throw some like really complex thing at me. And I'm like, I don't have the code books memorized. Like I can look that up, but it's going to be really boring to watch me do it for the next like 15, 20 minutes. Yeah, Catherine Rose says the AMA has a great webinar that's free for the 2023 changes. So yeah, I would recommend, if you're taking your exam next year, I would say, if it was me personally and I had the money, I would get the new code book, because that would kill me if I got like a 69% on my exam and didn't pass. I would always be wondering, like, is it because I didn't get that new code book and I got an E&M question and I messed it up? That would eat me alive. But I understand, like, sometimes not everyone has the resources and stuff to buy their new books, so you got to weigh the risk. You got to weigh the risk. I have a hard time with sequencing ICD-10 CM codes. Any tips? Guidelines, and then also making sure that you're reading some of those instructions in your ICD-10 CM book. So like, for example, let's see if I can find one. I think the books make the sequencing easier than some of the lookup tools because not all of them are intuitive. But like, let's say, for example, I'm looking at something here where let's zoom in. Zoom. N16, like it says here, to code first. So when it says code first, we know that one of these codes has to come first. This code then would come afterwards. So with sequencing, it really is a matter of really reading some of those instructions in your book and then also getting familiar with some of those guidelines in ICD-10-CM. So for example, I can't remember, I batch recorded a whole bunch of short form video, and I don't think I posted this one yet, but like your acute before chronic. So if you have a patient who has, for example, acute kidney disease and chronic kidney disease, which do we sequence first? The acute. And I always say, remember your ABCs, acute before chronic, ABC, acute before chronic. So your acute conditions get sequenced before that chronic condition gets sequenced. But that, just know your guidelines and pay attention to some of those little notations there in the book. And by the way, just a reminder, I'm seeing I only have 5 thumbs up right now on this video. So if you want to just help me out by throwing a thumbs up on the video, greatly appreciate it. I watched your video and about your experience taking the COC exam a lot of times and took my exam on October 22nd and passed. Thank you so much for sharing. Absolutely. Yeah, I really want to get some more resources for the COC because I'm hearing more and more people that are really struggling with that one. And I did as well because if you remember from the video, like I thought it was just going to be like outpatient day surgeries. I'm like, oh, this is just going to be like lap choles and lap appies. Like I can totally code those. And there was a lot of payment methodology questions. And thankfully, I knew the resources to kind of look at in my books to find the answer to those. But yeah, that can be a little tough. That can be tough. Tasha says, at what point should a student get an AAPC membership while still in the training program or after it's completed? So what I'll say about that is you can only get a student membership once, the discounted student membership once, which I believe right now is $100. So even if you're in like another certification program in a year, you're only going to get that discounted student program once, and you get it for that first year. So you might want to hold off as long as you can, because the next time then you renew, you're going to have to pay the full fee, which I don't know what it is right now. What is it, like $190 or something? Has it gone up past 200 yet? Let's take a look. Membership. I think mine's actually coming due soon. 190, yeah, it's $190. So I would just put it off as long as you can. Now you do need to have your membership in order to schedule your examination, but I would hold off because then you're going to have to pay $90 more once you're renewing. F. Williams says, I just need some words of enjoyment. It's a lot to absorb. You know what? It is. It's, learning any new skill is going to be a lot to absorb. If you're learning, venipunctures, it's going to be a new skill and there's a lot to absorb. If you're learning even how to work out is a lot to absorb. If you're learning anything, how to ride a bike, it's a lot for the first time. It's a lot to absorb. And you just need to keep your eyes on the prize. Like, this is going to be a new career for you. It's going to be a new opportunity. It's going to be an investment, but it's going to be worth it at the end. So acute and chronic kidney disease are separate codes, and there's not a combination code. Correct. There is not a combination code for acute on chronic kidney disease. There's one for acute and then one for chronic. Ooh, yeah. So one of the things to keep in mind is with AEPC memberships is there are corporate programs. So one of the perks that certain organizations have is they'll purchase corporate memberships, which can then be discounted as a perk for the medical coders. But I do want to mention, if you're moved on or off of a corporate program, so let's say I'm working for the Mayo Clinic, they put me on a corporate program, that's going to change my renewal date and it's going to change my CEUs. Everything's going to be prorated. So I might not have my CEUs due until later. They might be due earlier. I might have more due. I might have less due. So really pay close attention if you're going on or off a corporate membership. And another thing to consider with the going off is, typically when you go off, you get like an email alert that they're just like, hey, your membership is due in like a month now. Um, and you're going to have to fork out then that money to renew your membership. And it's typically, if I remember correctly, a prorated amount then. Danielle's asking, I just started school for medical coding. What do the books look like? New books look like again? So the HCPCS book for 2023 isn't out yet. It's that time between October and December 31st is always kind of like a funny time, because, ICD-10-CM codes change October 1st. CPT codes don't change until January 1. The books all ship at different times. As an AAPC instructor, I've been informed, and I haven't checked in the past couple of days, but like the course curriculum information, I'm told, will be updated like mid-November. So kind of like, when do we purchase the new books and train? Do we hold off? Do we not hold off? But so far, I have my 2023 books. Now, different programs will tell you to purchase different books. This is the AAPC version of the ICD-10-CM book. I think I may have already put away my 2022s. And then CPT 2023. And let me think what else. And then HCPCS probably won't ship for a while. And again, depending on what program you're in, if you're in something through like a community college or through the AAPC, you might have a different version. The AAPC will give you the AAPC version, but if you're in through a different organization, they might give you an Optum version of the HCPCS. They might give you the AMA version of the HCPCS. There's different versions of them. Charlotte, yeah, Quizlet for the CPMA exam prep for those who didn't take your class. That is something I could offer. I would have to figure out how I could rig that up in order to kind of automate that. But yeah, if you're interested in getting access to the Quizlet for the CPMA exam and you didn't want to sign up for won't take offense that you didn't sign up for my CPMA class, but yeah, I can give you access to the Quizlet. Send me an email, victoria@contempocoding.com, and I'll figure out what I want to price that at. Instructor questions, you have to come up with your own course. So here's what I'll say in regards to that. Okay. So with the AAPC has an instructor certification. The instructor certification really doesn't teach you a lot about how to teach medical coding. It kind of teaches you about the instructor program. You can go through different paths with it. So if you mostly want to instruct in billing, you could take the CPBI, the Certified Professional Biller Instructor program. And basically what they do is they give you a abridged version of that exam that's more difficult. So instead of like for the CPC, you would take the CPCI exam, but it would be like really hard CPC questions and 50 of them, and you have 2 hours to do it or something like that. So it's a more condensed, difficult version. There's no questions about like how to teach on it. It's literally just questions from that particular credential. What happens is once you go through their instructor course, you pass the instructor examination, you are now allowed to license their material. So you have to pay a very hefty licensing fee in order to purchase the AAPC's official curriculum for whatever certifications you want to purchase. I have like 4 right now. I have the CPC, CBC, CPMA, COC, and CRC that I have licenses for. They're very expensive. You have to pay for them every year. But then you get all the test banks, you get all of the PowerPoint slides. Like, you don't have to build everything out from scratch. You just have to pay a hefty fee for it. You can just build out your own course. You don't even have to become an AAPC instructor. You really don't. Like, if you're just like, I just want to teach medical coding, you can go ahead and build up your own slides. You can build up your own questions, your own test banks. Like, you can't take other people's material and use them because that would be illegal. But you can, if you want to build your own course, you can do that and sell it. Like, the AAPC doesn't have trademarks on the concept of medical coding. They have trademarks on their they have, they have their official licensed curriculum, and they will license it to you for a fee, so you don't have to reinvent the wheel. ICD-10 and CPT books are out for 2023. Yes, they are. HCPCS I haven't seen yet. They usually don't. They're usually the last to ship. And I don't know, apparently not everyone got this, but in my CPT book, I got this little CPT E&M companion for 2023. I don't know if that's because I got the package deal through the AAPC. But I had a handful of people tell me that they didn't get this with their 2023 E&M book. But I haven't had a chance to look at it yet. I might like find some E&M training for 2023 and then just like lay in bed and cast it to my TV. That might be my weekend plans. Yeah, they have crazy dandruff right now with the new books. Yeah, Pam says the companion is fabulous. I haven't looked at it yet. I'm still mapping out everything I need to do for the remainder of the year. Carlita, did you get your book yet? Did you get your CPT book and then like it didn't come? I'm curious now if like you can order it separate. Like, is it supposed to come and then some people maybe didn't get it? Now the AMA, they don't have the AMA store anymore. Everything's through like Amazon. Yes, the Amazon link is listing it that it comes together, a bundle. And I wonder if you can buy it separate without it, or if I don't know. I don't know why some people are saying they didn't get theirs. Maybe they didn't buy the AMA edition of CPT and that's why they didn't get it. Does it have anything good in it, the little book? Yeah, it's all the 2023 E&M change stuff. I haven't taken a good look at it yet, but let me take a look. I'm sure it's a lot of the. Yeah, so like chapter 1 is hospital inpatient and observation care services, and it talks about the changes for 2023. Consultations, emergency department services. I mean, I'm sure it looks very elaborate. Late night reading material. Catherine Rose, I'm taking the CPMA exam soon. Any tips? Okay, let me take a look at the website because I think this is still here, but I want to make sure that it's still there since the redesign of the website. Okay, I think it's still here. So if we look here at the CPMA exam, and all the information that the AAPC provides on it. There is this little button here that says prepare for the exam, right? And down here, it gives you these additional preparation methods. You definitely want to get familiar with these because they are going to ask you questions about these additional preparation methods, questions about ABNs, questions about CERT, questions about compliance, CMS, fraud and abuse, HIPAA. So don't memorize these, but make sure that you kind of like breeze through reading these because there's going to be questions on the CPMA exam about them. There's definitely going to be questions about it. And with that, we're at the top of the hour, and it's been a great time hanging out with you guys on the stream. I will try to do this a little bit more regularly. And I love all the questions that you guys have asked. I love spending my time with you guys. I will see you guys in the next video. And until then, just keep on coding on.